Good afternoon, everyone. Today I want to present about the silent burdens and assess mental health of Indonesian women. This is one of issue in Indonesia, how the mental health of the woman in Indonesia are not assessed. Before we talk about further discuss about mental health in Indonesian women, I want to show you this figure. This figure, uh, we know that this is a woman's life stage from baby childhood and to be puberty and continue to maturity, and then after that, the woman can get menopause in age. Old age. Uh, this is the hormone from the childhood increase in puberty and to be high and stay in high level until maturity. And when a woman get in menopause stage, the hormone will be decreased until old age, around 70 and until 80. This is how to from this stage you want to know we can optimize to improving prenatal health requires early physical, mental, and social preparation beginning in adult. And the next is I want to discuss about Ministry Health Regulation of Indonesia in Indonesia. This is have a title Health Services of Women in Primary Healthcare. So not only physical but also psychological. It should be to be concerned in the health service in primary healthcare. But we can check together because my interest in mental health. I want to discuss more about that. From this regulation, this regulation mention about prenatal from the pre-pregnancy prenatal. They give the service for women before pregnancy to prepare for healthy pregnancy. And then they also give service for pregnant women from the conception to childbirth. After that, for the childbirth stage, they give a service from beginning of labor until 6 hours after delivery, and also give health service for postpartum phase. They, the government give services after postpartum services after birth until 6 weeks, and services that support infant born up to years, and then also continue in reproductive age that get the health reproductive including contraception and prepare menopause phase. And because concern in mental health, so I only discuss about the mental health. They give the government give mental health services for adolescents. For the first, because mental health services for adolescents. This is a mental health screening from anamnesis to explore the adolescents' psychological and emotional well-being, including their thoughts and feeling. And then they also identify this. They give this one of services identify any unspoken concern of health issue that may be hidden due to discomfort or lack of trust in healthcare services, and also have a earlier give the earlier detection with home, education, employment, eating, activity, drugs, sexuality, safety, and society. They also government in the regulation also mention about the screening with SDQ 25 strength difficulties questionnaire adapted from WHO. This in that you are also discuss or give information about the communication, optimize, use the communication, information, and education to encourage adolescents to develop positive attitudes, adapted health, lifestyle, and become active, independently individual who contribute to their own well-being, their families, and their communities. So communication, information, and education needs to be one of subtopic in emotional stabilization. The next is beside give service mental health for adolescents, the government also give a service mental health for couple before or after marriage. They mention in the regulation that through communication, information, and education, and also counseling, encourage the couple to increase knowledge and awareness to conduct safe and healthy behavior, including mental health. And in that regulation also mention the tools they use screening with SDQ with 20 items, yes or no question. Maybe from this part, we know that why the screening is same. It is same mental health service for adolescents, and we can use same tools, maybe also same, because this is a SDQ 25 and this is SDQ 20 items with yes no questions. Beside that, I want to show also for the services mental health for pregnant women. In that regulation mentioned about the counseling, they all of the counseling we know that examination, antenatal care result, gestational nutrition, uh, danger sign, and so on until exclusive breastfeeding. It is more the physical part, but only one item mentioned about the psychological aspect. This is a mental preparation. Uh, in that regulation also mentioned about one of pregnancy problems is mental health. They mentioned we know that one of pregnancy problem is mental health. Around maybe they can get the depression, anxiety, psychosis, schizophrenia. That is part of mental health. And for pregnant women, a pregnancy mental health disorder not only influence this part, services mental health for pregnant women is important because pregnancy with mental health disorder is not only influence for the mother but also can influence for the growth and develop of fetus after birth, childhood, and puberty. There is a lot of pregnancy mental disorder that it could be uh, happen in the pregnant woman, like a stress, anxiety, panic, obsessive compulsive disorder, bipolar, somat somatoform distress, PTSD, drug behavior, depression, and schizophrenia. So because the pregnant woman potential get the mental disorder, we have to give the optimized it should be we have to it should be we we provide service mental health for pregnant women. Um in that regulation, a mental health examination mention about the mental health examination for pregnant women from the screening and referring to higher healthcare if it is cannot handled in primary healthcare, and then how to manage the stress like this from recreation until listening to music, and also live promotion, live promotion, like we make us send the short term ceria, the C from cerdas in Indonesia, C is cerdas, in English is enhancing, C is enhancing uh, intellectual, emotional, and spiritual intelligence. Then for E is empathy, fostering empathy. R is related to religion, and I have a relationship, have a relation with the social interaction. I is interaksi in bahasa, interaction in. And asa asing and also it's like cultivating care, affection, and guidance for to support growth family. But it's unfortunately there is no mention tools how to measure the mental health for pregnant women. So how? And then this part is from Ministry of Health Regulation. The other part, just like this slide, I put from the mother and child book, or pink book, we say, yeah, buku KIA book. They mention about the depression, how to health, mental health of pregnancy, what they have to do, information about the mental health pregnancy, but there is no tools, again, no tools to assess mental health among Indonesian pregnant women from mother and child book. So at least uh, two resources no mention about a tool. And this one, a part that I want to more deep discuss about the uh, mental health program for postpartum. In this interregulation of the Ministry of Health, mention about postpartum care for women. The scope postpartum care for women including anamnesis, blood pressure, checking anemia until uh, vitamin provision of vitamin A capsule. Almost from a lot of scope from 1 until 14, only one part that mention about the mental health, maternal mental status examination. Postpartum care for postpartum care guide for mother and newborn stage um, health worker provide communication, information, education on the mental health of postpartum. But again, there is no prior screening or there is no tools to screening how to detect the postpartum depression or postpartum mental disorder. And the other part, um, we know that this is from the um, National Ministry of Health Ministry of Health. This is from the National Guidelines for Postpartum Care of Mother and Newborn in Indonesia. Also mention about the postpartum blues or um, moderate depression, postpartum depression or postpartum psychotic. They mention what the difference of the postpartum blues, postpartum depression, and postpartum psychotic. But the regular provide information postpartum depression characteristic three part that we know that mentioned in the national guidelines, that guidelines. But again, there is no tools. But after that, they mention about the information postpartum depression characteristic. In this part, the other part is still in the national guidelines mention about the mental health of post baby blues. They compare between baby blues with postpartum depression. But again, this is the regulation provide information and form. This is only the form. Unfortunately, no tools how to detect it. Again, from the national guidelines, the first one, this is a green. Green is the, there is no problem. No problem when uh, within 6 weeks postpartum. This is the first visit for postpartum because in Indonesia there is a service after birth. After childbirth, we have for postpartum visit. Postpartum visit. The one part is concerned about if uh, there is three categories: green and red and yellow. If in green area is still it's okay, there's no problem. We only make sure the mother had worry, the worries of mother can handle it. Need the mother only need the support. This question around how a mom, how the mother feelings, how the mother feel worry is easily. This is as depression trigger triad. Easy, having trouble sleeping, or feel sad, or feel useless. And if they mention there is no sign from the question, it's mean the mother can handle the worries or the mental health condition. If the like this one in the red area, we know that I want to show you that this is the question like how are you feeling right now? How have you recently experienced and lack of interest? Have you been feeling tired and low in energy? Have you been having trouble sleeping and so on? And Are you finding it difficult to concentrate? This is the question similar when we ask about the mental health in the depression or other. But here not mention what kind of mental health that they measure. And if there is a warning here in the red area mentioned that if there is two or more of following symptom occurring more than 2 weeks or more and representing a change from the individual usual state may indicate a mental health concern. This concern about this more we found yes for two or more from these symptoms that is include the mother condition include in red area. We have to give the support emotional support and refer the mother in the hospital because this is a context for the primary or lower grade. And still in the national guidelines mentioned about the postpartum postpartum visiting. This is only mentioned if you sad or cry easy, this is a symptom. The question similar with previous slide. They only give the number here, only number and number, and there is no information. Number one for what, number two have meaning like what, but there is no information about how to fill this column, what kind of number that they provide and calculate and get the conclusion from the condition mother, postpartum mother, especially in mental health. This is I got from maternal and child book also. Only give information about postpartum baby blues and postpartum depression, but again there is no tool to assess the mental health for postpartum after birth. Um, in we know that tools of women mental health is very a lot based on the WHO 2013. There is a several mental health screening for postpartum, like the Edinburgh, FETS. Also, we can use HATS or BTI or other that we can check or we can use the screening tool to measure, to detect, to assess the postpartum mental health. Because we know that the pregnant woman have had opportunity to meet midwife, psychologist for a psychoeducation session for two. Unfortunately, this happened only once during pregnancy and usually only during the first visit. In the fact, perinatal psychological disorder can be experienced by mother at any time, except maybe in the first, second, or third semester, or even 4 months after birth. So we can optimize for the tool from the WHO based on the information. This based on the WHO 2013 mentioned that there are several mental health screening tools for postpartum. In Indonesia, I tried to get to search There is already published about the APD test, and then for DSS-21, and validated for anxiety, skill, depression, population, and yeah, to this proven. This is the paper that mentioned there's um, psychometric tools from uh, screening tools, postpartum depression, but still there is no one tool that government choose to assess the mental health for women, enhancing midwife competency through targeting training in mental health screening and early detection. So maternal mental health remain a critical yet under addressed aspect of perinatal care. In the developing countries, uh, the prevalence of common perinatal mental disorders such as depression and anxiety is estimated at 15.6% during pregnancy and 19.8% in postpartum period. In Indonesia, the burden is even higher, with approximately 22.4% of mothers experiencing postpartum depression, highlighting an urgent need for comprehensive maternal mental health service. Without adequate follow-up services and management system, screening for depression offer little practical benefit to affect individuals. So maybe this is a long journey if we want to be to make one tools to make one tools to be a detection tool for um, depression postpartum. Like this one, start for this one assess the problem, special focus on the postpartum depression, and then assess the solution and policy choices, policy implementation, policy for evaluation, and make a policy modification. Needs incident of postpartum depression looking. This is the incident. We have to know the incident of postpartum depression and then looking into instrument to measure PPG, postpartum depression. Tools, psychometric and validation of PPD. We have to do uh, this part. And follow up, need the follow up to be Indonesian health policy for PPD management. Yeah, I think that's all. But this is the reference that I use. If we want to make a policy, it is a very long journey in Indonesia because we have to know the incident of postpartum depression. Because until right now, postpartum, we don't know the postpartum depression, how many or how prevalence of postpartum depression because there is no measurement. So there is no measurement, there is no report. So that's why we don't know the incidence of postpartum depression. We said that we have to looking the suitable instrument that to measure the postpartum depression because from the WHO there is a lot some of tools to measure postpartum depression like the previous slide. And the last one, if we can choose one tools or yeah, several tools, we can discuss and check the psychometric and validation. So after we get the tools in Indonesian version, I think we can implement. Not to after we get the uh, Indonesian version, not directly we implement in the postpartum because we have to make a permission from the government or maybe at least from the manager from the clinic or hospital to apply that tools. It's not easy one. So this is maybe a sort of long journey how to make a policy or to make rules to measure the postpartum depression. I think that's all. Thank you for the um, attention.